Providers then sometimes actually, decide to have a bad treatment with those, end users or beneficiaries. You're from this insurance, we don't like you, get out. Or wait here, or stand in the line, or lift your hands up, whatever. Okay, so again, then it becomes a service standard. So you're actually looking, if your accountant says, this company doesn't pay, make him wait until I check it out. And, you have the guy waiting there for 30, 40 minutes, he goes, makes a bad word of mouth for you, and, the whole industry loses its own credibility. Just because of, a few incidents like that. Now, when providers also do this, their other part bad of the game, which is filing bad claims or having, having claims that are not trusted by the insurance. And it's an industry of trust. It causes payers, which are insurance, to actually start suspecting that something is going on. As Ali said, those insurance guys are very clever. And yes, they are. Because they actually don't see your hospital only. They see all the hospitals. They don't see your doctors. They see all the doctors. They could have the same procedure here and there and there and there done differently. And then they evaluate. So they actually have more eyes to the, they have the helicopter view of the health industry. That's why, again, it said HIPAA, the I stands for insurance. Okay? So it's mutually beneficial to all of us to deliver the requirements and come up with top quality systems and top quality procedures. As I said, our industry is based on trust and information, quality of information. Now let's look at what the other people are doing quickly. We have the US, which with an E-rate, I would like to call it, an E-transactions rate. That 70% of all the hospitals sending their claims electronically. 70%. So if you guys like to go electronic patient record and all that, that's also nice, fancy. But I think you have to get there first, because they're just trying to get the electronic patient record after doing this. Electronic patient record, and I was trying to say this actually before, is a byproduct. It's a result. It's not a goal, it's a result. And please, really, I've seen a lot of people talking about the electronic patient record, the electronic health record, the electronic medical, whatever you name it. It's a byproduct of a good information system and good data entry. It's not a goal you get to, it's a result. In the pharmaceutical industry, 95% of them are actually sending their claims electronically. In South Africa, 80% are actually getting sent electronically. In Saudi Arabia, you think is, guess it? 1%. Okay. Okay. All right. We don't have much time, but I'll tell you actually that 200 providers are getting online services now, and by 2007 you'll have 60% out of 400, which actually cause the 80% of the industry. Actually, these guys are the 80% of the industry. So they are very good actually, but they're going very good. Due to the pressure time, I'll go through those quickly. And these are the reasons why the insurance actually likes electronic transactions. It reduces the time of processing. It reduces the time for the approvals, which means the time the patient waits to get their services. And again, they have a competitive advantages because then you control the cost when they do it electronically instead of paper. And they improve their overall services because when they pay the hospital better, the hospital treats their patients better, and so on. So the cycle is continuing. For the providers, we're improving the bottom line. We're accelerating payments. That's what matters to everybody, I think. We're reducing the administrative cost. We're reducing the papers out of that, which means a lot of saving, I think. When I say papers, I don't mean papers. I mean what goes with it. Yeah, the people who process it and everything else. We're eliminating claims for invalid cards, exhausted limits, up-to-date monitoring. You name it. When you get online, when you do your transaction online, you can slice and dice your information the way you like. Quickly, let's see what's in it for the insurers. When they have accurate eligibility and deductible information, 80% of the issues are actually solved in insurance, because that's where it all falls to. As I said, awareness and knowledge. Ability to review and updated limits, the insurers can actually see what's in it for them. And of course, eliminating delay in getting services means overall improved healthcare quality. Now, and this is an example of on the state what happened. An insurance company actually went and acquired WebMD, an insurance company called HealthyOn, acquired WebMD only to actually deliver eligibility services. Believe it or not, they actually acquired the whole company to get eligibility services. And then again, they acquired Envoy to do claims processing and management, which is very, actually, it shows you how serious these guys are. Healthium is one of the largest insurance companies in the US. Now, this is the slide where I was actually planning to spend so much of my time. Okay, this is a question I'd ask to everybody. And would you like your hospital to represent your country at the WHO? Sounds like a good proposition, isn't it? Yeah? Well, quickly, and if somebody gives me the time to actually go through this, and this is really I call it the pyramid of the information. Now, I don't know if you see this quickly, but if you look in the lower level, you guys are there, you're providing atomic level data, which means patient data. Now, the scope of this data is individual patient data, which you guys, all of you are actually participating too. And this is used by the caregivers, the agencies, and everybody else. If you take this information, abstract it, summarize it, and aggregate it, you reach to an agency-wide, you get to an agency-wide data, which means a larger view of the healthcare industry of the patients. Then you can actually calculate cost care by category of patients. You can find number of patients admitted with specific diagnosis. There we go. I mean, I think if anybody of MOH who's listening to this is going to be very excited. You can find the volume of tests, procedures, the way that you can start to have an image of the agency patients. If you take this information again, aggregate it and summarize it and abstract it, you will see now you can have a comparison of treatment everywhere around the community or the region. Say, for example, this western region, this northern region, this region treats this disease better than the other region, or in less cost, or by less, you have your whole information, you can play with it. So again, when you actually take this information above, you have a nationwide information. So as you can see, the atomic level went to a nationwide information. Then you have a country's information. You have trends in incidence. You have trends in the diagnosis. You have trends in the diseases. You have trends in procedure. You have trends in pharmaceuticals. The whole thing starts to play a whole big game there. Obviously, when this information gets above, you're actually going to the WHO. So this is how you actually participate to getting there. Now, I'm just trying to actually zoom in. EDI is something they spoke about already. I don't want to really reiterate. I just wanted to say that there are two ways, reactive and proactive. And you obviously are smart enough to actually tell which one should be done. I'll talk about the reactive when you have a clearly defined process need, and the need is there first. It's not a joy, it's not a hobby, it's not a goal. Yeah, we go, EDI, and you don't really define your needs. And there's a whole trend of everybody to go on reactive because they get excited. They attend such a conference, they get excited, and they go and do it, and it gets messed up in the end. You really need to have it. Now this is quick one. This is how we are today, or at least were. This is some sort of an electronic patient record, gentlemen. It's not one, it's actually represent a portion of it. So this is how doctors in hospitals, any hospitals, were actually sending requests to the insurance. And then they wonder about rejections. Let's see if we can see anything. Can you guys tell anything? This is an actual patient diagnosis. This is somebody's life. And this is doctor's response to the somebody's life thing. Okay. Anything? You can't tell nothing, I know. Now let's see what happened now back in Saudi Arabia. That this whole thing went there, got electronized, got done for everybody. Now you have your general information part, you have your case diagnosis part, you have your services part, you have your comments part. This all is electronized now. Everybody's doing it. It's clear. It's fantastic. Everybody's happy. Now this is how the insurance got it. You've seen the miles of papers. This is how the miles of papers look like now. Yeah? Quickly, this was a funny thing. I used to always have fun of this. I used to have a crack at this. Anybody can tell us what is this? I don't think anybody would do that. To the lack of time, I would tell you these are claims. Not sandwiches. No. These are actual claims that they want the insurance to pay. Look at that. Interesting. Can I have ketchup with that, please? Anyways, these are samples of claims. And this is how the insurance goes again and files it and does that and does that and does that. And then again, you wonder why they're taking this long to pay us. So, this is really sad.